All right. Hello and welcome everyone to our Facebook Live today. We are again joined by Dr. Loren Hamel from Spectrum Health Lakeland and Dr. Cabaltica from the Berrien County Health Department. So we do have our headlines here up on the screen to share with you. So these are the items that we're going to talk a little bit more about and share some more information on. So we will go ahead and get started with Dr. Cabaltica. If you could just share more about the latest trends that we're seeing on COVID in general in Berrien County.
Yep. So we've been seeing nearly an exponential rise over the past 2 months, and it looks like it may have peaked, but it's still too early to say. Over the past 7 days, we've seen cumulatively nearly 1,000 cases here in Berrien County. So that's about 125 to 126 new cases each day just the past 7 days. So that's quite a few. Our positivity rate, the percent of tests that are done that return positive, is still about 23%. So 1 in 4, 1 in 5 tests that are being done are still turning positive, and that puts us still in what the CDC has defined as a high community transmission rate. So still seeing a lot of this disease spreading in the community. We're seeing increased numbers of new COVID cases and widespread community transmission. As far as in the school systems, we're seeing about 75 students or cases isolated with positive COVID-19 in the past 2 weeks. There's 256 students, close contacts, who are in quarantine. They haven't turned positive, but they are being sequestered in order to try to stem the spread of this. So again, there's a lot of this disease still spreading. Omicron is out there. We don't know that it's necessarily hit Berrien County, but we know that it has hit the counties to the north of us. So yeah, we're still in the midst of this.
Thank you. And Dr. Hamel, Spectrum Health Lakeland recently moved their command center status to red. Can you share more about what that means and what we're seeing in terms of our census overall?
Yeah, certainly, Jessica. So when we're at command status red, it means that our capacities have been, normal capacity have been exceeded. We're placing patients in areas that we don't tend to place patients normally. We have staffing ratios that are higher than they normally would be. It means a nurse is caring for more patients than they typically would. We expected that. We worked to get ready for that. The team is working hard to accommodate those higher volumes, but that just indicates that we are over our normal capacity and now working in different ways to meet the needs of the community.
Thank you. And what are we seeing in terms of our overall census at the hospital?
So our peak last week was at 84. We're running 69 today. That number, of course, varies by how many people we admit and how many people we discharge. That number also drops, and we have somebody in the hospital long enough to take them off COVID isolation. They may still have a diagnosis of COVID, but they're no longer contagious. And so we take them off the list for that reason as well. So it is still very full with COVID patients. I would also just indicate that of those current 69 patients, 88% of them are unvaccinated. 100% of our ICU patients are unvaccinated. And essentially all of the deaths that we've experienced over the last several weeks have been individuals that are unvaccinated. So it's still really important for you to think about whether you've been vaccinated or not, and whether it's time for you to have a booster. That is very helpful in protecting you against severe illness, hospitalization, ventilator use, and ultimately death.
And we did have a few questions earlier in the week about surgery deferrals at Lakeland. Can you share the latest for us?
We are working extremely hard to keep up with the community's needs for surgery. It is hard to catch up when you postpone important surgeries. And of course, it also can put people at risk. So we're doing all we can to keep up with the current surgeries, and we're keeping up with essentially all of them. There are a few patients that have decided they could wait, but we're doing our best to keep up with the necessary volumes.
Thank you. And we know that the Omicron variant continues to spread throughout the U.S. Can you share the latest of what we know at this time?
Well, across the country, it's being reported that about 73% of the new cases are Omicron. We have not been in the middle of this particular variant long enough to be able to say a lot about its performance, but we're learning some things from other countries. It's a little risky to extrapolate that data, and you might say, why is that the case? Well, our populations are different. The average age, the vaccine used, the proportion of the population that is vaccinated, the proportion of the population that has natural antibodies, the age and illnesses in a population, of course, impact the disease. But what the early indications are that this is not as bad a strain as Delta when it comes to virility, when it comes to putting people in the hospital or causing death. On the other hand, it is markedly more contagious. And so that mix of way more contagious and maybe a little less severe, we don't know yet whether this is going to drive our hospitalizations much higher or about the same as the Delta strain. I suspect we're going to learn that over the next maybe 2 to 3 weeks. But for now, the Omicron is just exploding around the country. It will become the dominant strain. Even though that virus may be a little less severe, we still have Delta in circulation in our community, and we still are seeing young individuals in our emergency department extremely sick with Delta. So it's not just worrying about Omicron coming, it's also that we're still in the middle of a Delta surge.
Thank you. And Dr. Cabaltica, just to add on that, have we seen any of this new variant here locally, or how are we tracking that?
Usually how that happens is it's sent to some fairly high-tech state labs and CDC for genomic analysis. Dr. Hamel just mentioned, I believe just before we went on air, that Spectrum Health Lakeland now has that capacity coming locally. So whereas before it would take a week or longer to get that answer, hopefully we'll be able to spot that variant within a matter of a few hours as we start sampling more of these positive tests. So yeah, I think we just need to hold tight and do the things that we know will decrease the spread of this virus. The masking, vaccination, especially boosters in particular. We've seen that the call for the boosters has been in light of some of the other countries' experience that simply having had COVID-19 gives you some level of protection, but still not as good as vaccinated. And even if you're vaccinated, you can still get breakthrough infections. And those breakthrough infections are of course, more severe in the older populations, but you can also spread it to those who are more vulnerable. And finally, if you actually have the booster on board, if you're eligible for the booster, then you can actually, you see a much lower transmission as well as infection from all the variants. And we hope that Omicron is the same, but again, we're not sure yet.
I would just add to that vaccine discussion that when you received a vaccine, it was at that point impossible to predict how this virus might mutate and how those mutations and that vaccine would interact. What we are finding out about Omicron is that the J&J vaccine does not produce much resistance at all to an Omicron infection. The Moderna and the Pfizer vaccines, which were used in our community as well, a significantly greater protection. And as Dr. Cabaltica just indicated, with a booster, some really good protection. Now that protection might not prevent illness, but it seems to be very effective at preventing serious disease and death. For those of you that had the J&J vaccine, get a booster. And that booster should be with Pfizer or Moderna. That will give you additional protection.
Thank you. And booster recommendations also recently were strengthened by the CDC for 16 and 17-year-olds who received Pfizer. Dr. Cabaltica, can you share more about that?
Yeah, that's right. Pfizer is the only one that's been authorized for use, EUA use under 18. And so that's why those who are 16, 17-year-olds, they were in the window now for some of them to actually get the boosters. And that has been recently, I think in the past week, been okayed by the CDC. So get that booster. if it's been 6 months since the second shot of the mRNA virus. Certainly, if you've had, just as Dr. Hamel said, if you've had the J&J, they're recommending the booster within the 2-month period after the J&J vaccination. So that's everyone 18 years old and older can go ahead and get that. We're no longer limiting it to just if you've had some underlying illnesses that would put you at high risk. We're really starting to see that, immunity, especially as far as variants arise and mutations arise, seems to wane with these. So if it's been 6 months or later since Moderna or Pfizer, go ahead and get the booster if you're 16 or older. So and there's plenty of places that will do that. You can do that here at Berrien County Health Department. A lot of the other pharmacies, as well as your primary care provider, can also provide those boosters.
Thank you. And as a reminder, Lakeland also has recently expanded their vaccine clinic at the Center for Outpatient Services. So it's now on Tuesdays and Wednesdays. And as Dr. Cabaltica mentioned, all the information is available on both the health department and Lakeland's website for available scheduling opportunities. And so we are getting ready to head into both the Christmas and the New Year's holidays. And so we know that vaccination is one of the best ways to protect yourself and others. But what are some other steps that families can take in order to minimize risk?
The holidays are always a difficult time. I mean, it's a time that everyone's going to be gathering together. Many of us travel to different regions, so that involves potential exposures along the way. But it also means that the risks from each community that you're coming from and going to, you have to pay attention to that. And some of those things that also come into play are, are you gathering with those, those family members who are going to be at high risk? Have they recently gone through, cancer surgery and are going through chemotherapy? That puts them at high risk. For many of the folks that have COPD, sometimes they're going to be put on steroids to help tamp down, a COPD flare. Well, the doses that we usually use for that can be immunosuppressive, especially if they're used longer than 2 weeks. So, have those conversations ahead of time. Has anyone been sick? Anyone have recent surgery? Any health concerns? Because that could potentially be disastrous if you all gather together and you aren't paying attention to the things that you can do. Now, what are some of the things that you can do? We have, in addition to the vaccinations this year, you can actually get tests done, over-the-counter tests. There are tests that you can actually schedule online. And I know my family and friends in my community have used, do I need a COVID-19 test? That'll show some of the spots where you can actually get some of these tests with a turnaround time of less than 24 hours. Mars in particular seems to specialize in the NAAT tests that they'll give you the results within 30 minutes. And so consider getting tested before you gather together. Also have those, it's difficult. Every family has its own dynamics. Some families can have very frank conversations about, have you had your COVID-19 vaccination? What do you feel about that? At least have those conversations so each one can make just a responsible choice of, do we want to join in? Is this going to be too big of a crowd for our own comfort level? Or is enough people vaccinated? You have 90% of your family vaccinated, so this feels like a lot more comfortable, a lot safer. And so there are those tests that we can do and conversations that we can have before you go. I know some of my friends, I first rolled my eyes when some of my friends said, "Oh, we're going to get together with family over Thanksgiving, so we're just not going to get together with anyone else for 2 weeks." I said, "Wow, that's a little severe." And yet, as I think of it, that's actually a wise thing, because they were going to travel and visit older relatives. So yeah, that's a good thing to keep in mind. Again, in the holidays, I think in previous times we would always be, warning people against, drunk driving. Don't drive drunk, because New Year's is upon us, Christmas holidays. If you do partake of alcohol, then you shouldn't drive drunk. Likewise, with this incredible, unprecedented public health emergency, I think it would be very unwise to say, I'm so over this, I don't want to do anything. Let's just get together. I think that's not taking the precautions like putting your seatbelt on when you're driving, or making sure that if you're going to partake in alcohol, that someone's going to be the designated driver. So take those measures that we know do work. Try to limit your exposure when you're out and about in public. Mask up when you're in fairly crowded situations. Getting that Christmas shopping done, getting the grocery shopping done for the get-togethers, and then consider having a test before you actually get together. Because I think we've heard stories on the news where folks didn't have any symptoms, they got together, someone showed up with symptoms just a day or two later and exposed their whole family. So let's do this wisely. I think it would be unwise to not celebrate. I mean, we've gotten through nearly 2 years of this. So let's get together with our families, but let's do this in a wise and loving manner.
Thank you for that. And I will go ahead and open it up to both of you for any closing remarks that you'd like to make to our viewers today.
Well, I would like to thank Dr. Cabaltica for taking the last question. I was very thoroughly covered. My own situation, I'll have some of my family celebrations virtually. And we've learned how to do that and have done it pretty effectively, and that's important. We also committed to share with each other transparently if anybody has symptoms, and of course we test liberally. Just try to keep everybody safe, so folks are kind of making their own informed decisions. What I'd like to say is just I hope you have a blessed and a very healthy holiday season. We're so grateful that you tune in, that you care enough to listen and think about how you can keep yourself and your family members safe. So thanks so much, and I certainly wish you all the best in this holiday season.
For myself, I would just say an amen to that, Dr. Hamel. That we're looking forward to a holidays where so many of us look forward to a hope. That in the depths of winter, there is always hope for a spring. And that's what I'm hoping for with COVID, that it's been a tough slog, but we have so many more tools now. We know so much more about the virus. We don't know everything about it, but we know enough now to be able to help each other keep safe. It was encouraging to see the president outlining yesterday just some more support that he's providing to the hospitals, to the community through testing and pharmacies. And so I think we're gearing up to be able to have the tools to finally get through this pandemic. So don't lose hope. Celebrate safely, and again, just hoping and praying for a better new year.
Mm-hmm.
Thank you both. Great reminders. And as always, you can find all of the information about COVID on our websites at spectrumhealthlakeland.org/COVID-19 and bchdmi.org/COVID-19. Thank you so much for joining us today.